to have you finally.
So, no, actually, the
Virtually,
thing
we are
is,
connected.
when I saw the series of program, I'm really happy to participate. Like you had a very good speakers, like in the past events, and also in future also. I'm just following your updates through email and all
Thank
the
you
social
so
media
much.
handles.
Thank you.
It's a very good
Thank
thing,
you.
like you are doing even during this health crisis which is happening.
Thank you so
So
much.
so these things motivate like people who really wanted to like create their journey in a different level. So now
Definitely.
people are actually, even though people are over engaged in online, so because everything is happening in online nowadays, so people are over engaged, even though like we are getting very good number of participants, even we are getting very good experienced speakers. So that makes actually sense. So like this is what we can give them, we can utilize this time, and we can reach people with our like small knowledge what we have. So
Definitely.
it's really wonderful that you are doing such a very great
Thank
work.
you so much. Thank you, Dr. Ram. So, welcome everybody for today's webinar series. And it's our pleasure to introduce Dr. Datchanamoorthy Ramu. He is a founder, Sustainable Development Council, and an International Youth Forum. He is associated with the Center of the Study of Global Human Movement, Cambridge University. He is a wonderful person in the field of human rights and particularly in the field of sustainable development goals. Uh, he is been associated for so many years in the field of sustainable development goals, health crisis, and how we can change the upcoming scenario, because COVID-19 is actually giving us the opportunity to deal with the impact of health crisis on a long run in a futuristic way. So today's topic is very useful to discuss for this particular pandemic crisis. The impact of health crisis on achieving SDGs by 2030. It is almost 2020 going to be over. This is the mid of 2020 and we are going to see a crisis all over the world. India is not the exceptional. So how we can deal with and how in the long run we could do something in a collaborative task, because we need to form a forum like WebPlatform4Dialogue is a forum where we can share and we can create a wave-like situation, connecting people who are in a similar wavelength. So our motto is connecting the minds, bits and bytes. So the connectivity with this dialogue is very important, and whoever is going to be here in this particular session, I request all of them to be in touch with Dr. Ramu in a personal touch, because he is one of the finest person in the field of sustainable developmental goals. Thank you so much for accepting my humble invitation on the first day. So I really thankful. So the floor is open to you, sir, and we will have the discussions at the end of your presentation. Thank you so much.
So thank you for your warm welcome and very good. Even I don't know that I have this much things to get introduced in such a forum. So anyway, thank you, Swati ji, for a platform that which we can express our our feelings or any other ideas or any initiatives like such a platform. So which has to be done. Even in this health crisis, global health crisis. So basically, so thank you once again, and I just wanted to move on with my presentation. So hope you guys seeing my screen, right? So if someone say yes, then I can start, because I'm just moving things to my PowerPoint presentation. So today's topic is which was irritating me from the day when I heard about this COVID it's been a pandemic and which have been spreaded in around 190 countries. So which have put ourselves in our home. So basically, the title was Impact on Health Crisis, especially COVID, on Achieving SDGs by 2030. So hope you guys know about the basic of this SDGs, so which have been resoluted by 192 countries on 2015 in United Nations, that they need to achieve 17 goals uh, with 169 targets and 232 unique indicators. Hope you guys know the history of these SDGs, so which have been, which is not a new topic or a different thing like which we need to speak about, because you guys know that before 2015 we just acted as a Millennium Development Goals. So people who really work for the sustainable development, they know that how these SDGs have been derived, and what is the importance of SDGs. When United Nations, they wanted to create a peaceful and very good society with the motto that no one is going to be left behind. So they found the sustainable development goals, and we just worked over 5 years to just for informing that like this world community that we have such a target, and the target have been fixed on 2030. So we need to achieve the things by 2030 itself. So hope people know that we have been worked very hard to reach these 17 goals to all the human beings of this planet for the past 5 years alone. So we just started to launch this SDG in all the countries by 2015, and we took 5 years alone just for reaching and telling the people that we are working on this kind of target, and we have these many unique indicators, that through indicators we can find that whether a goal have been achieved or not. So this is a basic step. So it took around 5 years. So hope people, you might think that for just reaching these topics and these goals alone we took 5 years, and we just stepped ahead for the next year to implement these goals in their local government. All the government have committed to like engage and achieve the goals on a particular time. So we just stepped out from the paper policy to action. So we have a lot of policies in paper ways, but we can't find that in action. So that is the main issue. So when people, they decide that we need to get out of this kind of papered policy, and we need to approach the real world with for achieving these goals on 2030, then we just stepped out like one step ahead from our home and office and anything. Suddenly this COVID came from an very rural village, and it spread across 190 countries now. So we all know that we are in a very big health crisis, and we have been pulled to change our lifestyle every day. So you guys know that people, they can't able to go to schools, and they can't able to get skill, and they can't able to even many people, as Swatiji said, that many people, they are suffering financially. Even many countries are facing economical issues. So these when we got this sudden kind of health crisis, so our ultimate aim is to eradicate the health crisis. So it's a very usual thinking. So people usually, they used to do these things. So when it stuck into my mind, then I say, okay, I was thinking about something that, okay, so anyway we are not going to anyway this will be a very big disaster for achieving this sustainable development goals by 2030. So I just noted out a few things, that what's happening now and what should be corrected. So as you know that we have the SDGs. Number one is no poverty. So usually we know that we are just doing our best to eradicate the poverty in all the countries. So due to this health crisis, particularly COVID alone, so there might be an additional 395 million people will be suffering from the extreme poverty in South Asia alone. So if it is from basically, you guys know that Asia is the continent which occupies the half of the world population. So the number is very high. So we had an aim, and we had an investment policies, we had an things to do to eradicate this poverty, uh, like before this COVID. But due to this COVID, around USD 500 million per day, like poorest people, they can't able to sustain their life because they can't able to go for a work. So people who is doing business, they are also being affected due to this kind of COVID. And we need to think about the people who really already in a poverty level and who really works for the daily wages. So these has to be monitored, and these has to be been rescheduled. So this is what, so government should have an action plan for additional action plan to bring up these people, uh, uh, like who can get out of this kind of poverty level. And basically these kind of poverty ratios can be eradicated only by enriching the people who below the poverty with the financial support. So as you know that world governments are doing a very good initiatives on bringing these kind of things, but due to this particular COVID, the global poverty rate can be uh, doubled from the statistics what we have today. So this will be a very big barrier to achieve this particular goal. So we need to have a different plan and different financial schemes to upgrade and enrich these people who really below the poverty level. So this is the first thing. Then when we go for SDG 2, it's hunger. So usually people, we know that many people, they are suffering from hunger before this COVID also. We might have seen many people still they are staying in home, staying in roadside, and even every countries they have the same issues. Many people, they are staying in roadside and in slums. Many people, they don't have a money to have a food, even a one-day meal. So even least developed nations, they are going to suffer a lot on these things. So so this hunger, it's not only because of this financial situation, and also since COVID have made people to stay in their home because they can't able to move, and they need to maintain the social distancing and all other stuffs. So due to these things, there was a very big negative impact on crop production and food product. So actually, usually we know that we are not, we can't able to move from one place to another place due to these things. The food which have been donated, or food which have been produced by an farmer, have been stuck in godown only because of supply logistic mismanagement, or people can't able to mm, move from one part to another part. And additionally, there was a statistic say that around 800 million people are going to face under nutritionment in this world. So we need to take care of these things. So we need to speed up the process of like engaging people to produce supply logistic, and to have a proper food plan for each and every people. So there was a stats was saying that these zero, like people who is suffering from the hunger, could be raised double to 156 million in this year alone. So since we don't have a proper medicine scheme, proper treatment plan, proper vaccine or anything for this COVID, and we don't know how many months this is going to be continued. So we need to come up with an alternative plan. So we need to find a plan to help farmers to do the crop production, and to like supply that to a particular part. And the developed nations, they have been stocked up a lot of grains and crops and all the stuffs in their godown, and these can be dispatched to the least developed nations or developing nations. So people who really suffered in hunger, they can have at least a per day meal to save their life from the hunger. So usually people, they are thinking that many people, they are dying due to COVID, and because they forgot that what are the other disease and what are the other reason behind many people, they are dying in roads, and even in rural villages. So stat says that many people from this world, they are dying due to hunger alone. So we need to concentrate on alternative plan to supply these kind of foods, and we need to ensure and we need to force the government to have a plan to take care of these people who really suffered for a 1 day meal per day. So this has to be managed. And when it comes to hunger, and we need to speak about the overnutrition also. So people who have the access for over food, they are having the overnutrition. So these has to be monitored through a different way, and people have to believe that people have to know about the others people's status on this kind of food. So when we speak about the stats and the numbers are very big, and we know that 800 millions, it's not a very small number that we can eradicate in a day. So if 800 million people is going to undernutrition only this year alone, then you need to care about the people like the newborn babies and the babies which is going to be land in this world after and during this COVID. So we need to take care of these things, and we need to move with alternative plan for crop production and also the supply logistics. So this has to be done locally from the government, and which can carry and a movement to ensure that all the citizens of their countries have sufficient food and like sufficient nutrition to save their life. So people, so I don't want to speak about this health and well-being now, because all people, we know that the overall death ratio of this COVID is increasing day by day, because it's very new. And when we speak about new innovation, new technologies, new science, new medicines, and all the steps which doesn't work or doesn't touch this COVID. I don't know like what's happening behind these doctors and research scholars and all the peoples there. So when we speak about health and well-being, so now we are actually we are facing a very big health crisis. I can't say that no, but the thing is, people who is dying due to COVID is less than the people who dying to a pre-existing disease, like pre-existing disease. So which have been I have listed here. So around every year around 17.79 million people, they are dying just because of cardiovascular disease. Now this health system, now this health practice, they doesn't care about this kind of other kind of pre-existing disease or other airborne disease, other spreadable disease, other seasonal diseases. So we need to ensure that our government is having a sufficient health care movement for handling these kind of alternative pre-existing diseases. So usually, as I'm from India, so I just heard very few newses that many people who is suffering from diabetes and pre-existing heart diseases, they are not being tested, they are not being treated. Their regular medicines have been stopped because of mismovement or mismanagement of transport and all other stuffs. So when doctors and these research scholars, they are busy on managing these kind of pandemic, they need to look on these kind of alternative things also. So developing countries and developed countries, they might have sufficient doctors, sufficient healthcare networks, but we need to think about the countries which don't have a proper a good hospital in a very important towns. A country like Africa and a country like country in the north, like east, they don't have the proper infrastructure development. They don't have a proper kits. Even you might have seen in many newspapers and many news articles that many countries, they don't have a sufficient testing kits for COVID alone. Then we need to think about the people who have an pre-existing disease and how their medicines have been supplied, and how many people they are mobilizing, how many people they have other diseases, and we need to think about like forthcoming seasonal diseases like malaria, dengue, and other stuffs also. So the government, the local government has to come up with an alternative plan to concentrate. They need to involve all the civil societies who is working for the health causes. So they can involve Red Cross, they can involve other medical and health related peoples who can support these kind of people with ensuring that those people are getting regular medicines and all other stuff. So this has to be managed only through the associating people with these kind of NGOs and all other stuff. So this has to be monitored, and this has to be done in a proper channel. So when we are in a global health crisis, so it doesn't mean that we are not supposed to take care of the pre-existing disease, and people they need to form a separate team to monitor such things. So that is my only suggestions. So even the government are doing such things, so but the thing is the beneficiaries are not exactly benefited through these kind of activities. So we need to have an alternative plan. We need to ensure that sufficient healthcare workers have been appointed in the government and in the also private hospitals who can tackle this kind of situation in the future. So each every government and all other public and like private hospitals, they need to ensure that all of a sudden every time, so these people has to be replaced. So usually we know that it's a cycle process. When a doctor is getting retired, so usually government is taking around 2 to 3 months to replace the doctors. So in that place, so we need to have a fast process on these things. So when a doctor or a nurse is getting retired, we need to have a spontaneous replacement on that position. So we might not get a lackage on treatments, or we may not get lackage on maintaining the databases of patient with pre-existing diseases or infection or anything. So we need to take over that thing. So this has to be done, and this has to be monitored in a well manner. So these kind of health crises can be monitored, and these kind of health crises can be eliminated in future very easily. So there are many countries they are suffering only due to lackage of healthcare workers. So government should come up with a policy to make sufficient healthcare workers. So they need to train people with basic healthcare hygiene things. So after this COVID, when this COVID is like arrived, then people now they come to know about few words like pandemic, isolation, social distancing, basic hygiene. So I don't know. I don't know these kind of words before this COVID, because we are not teached about those stuffs. So even though we are well educated, we are much care about our personal hygiene. But the things, these kind of new things and these kind of basic things has to be uh, given to the students when they are studying in a school. Maybe it can be implemented in the grade 7 or 5. So they need to teach about those things. So before our handling of flu is very different. So now due to COVID, now people they know about this kind of social distancing. When they have a common cold, when they have a common flu, when they have a common fever, they need to isolate themselves from others just for not spreading virus or any other infection, or any other fevers or any other things to others. So these kind of basic health science has to be taught to everyone through a social campaign by the government, and also with the support of many CSOs. So that is the only step to achieve these kind of things. And next thing, when it comes to a research and the other part, so we have a lot of obstacles. We have a lot of limitations when they go with the research or something. And I can personally see that many international politics is going around like finding this COVID vaccine and all other stuffs. So, and we need a transparent number on when we speak about this infected and death ratio, particularly during this kind of health crisis. So transparent numbers will determine the exact date and time when we can eradicate these kind of things. Transparent research can only help people to find the things. So we need an alternative plan, and we need an alternative solution for like finding and doing this research and all the stuff. So basic healthcare education is needed for from the school level, so people can study about the basic health hygiene, and about they need to know about each and every disease, how it comes and how it transforms, what is a transfer, what is a transferable disease, what is a non-transferable. Everything have been already taught, but we need an advancement on that thing. So we can fight against any kind of health and other things in future very easily. So that is my concern. So then quality education. So this is an well-known topic to all of the participants here. So everyone knows that no student is going to school or college or anything only because of COVID. So even UNESCO said that like 1.25 billion students have been affected. As India is a youth nation, we know that 42% of our population is below 35. So hopefully we know that around so we can conclude up to 38% of Indian population is below 22. So these particular people, uh, their role is only to get educated. So you can know that how education is playing an important role in our society alone. So even though we have like alternative solution for this thing, so many schools and universities, they are going through online, and they are doing exams through online. Even people from rural parts, now they know how they can get knowledge in online. So the thing is, it's a very good part that we have an alternative solution. But the thing is, so when it comes to a country like India, so India is it's a very diverse country, as you know, as you guys know that. So we have ultra modernized cities, and also in a very rural village which don't have a electric current supply. So we need to understand that if we are going with alternative solution, we need to come up with an implementation strategy. So when we don't have an implementation strategy, then there is no use of alternative solution for an issue. So when it comes to an education, we need to understand what is the important, then how we can reach to the people who really wants to get educated. So even this COVID is not in now, and we don't know that how many months it will take to find a appropriate solution. So we can't able to keep these people in our home without a proper education, because if they are going to lose their time, and as you guys know the value of time. So when it comes that when it comes to students, they should get educated regularly with the exact lesson plan what the teachers have, because it have been built educationally, socially, even mentally. So now you can see that many people they are using their technical gadgets, and they're spending their times, and even we can't able to force them to study now in online, because even we have issues with handling the technical stuffs with the students. When it comes to village, they don't have a proper internet connections and proper equipments to handle a school. So what I suggest is, so we need to get ready with another plan, that how we can transform this technology to each and every student's through their home itself. So even some of the governments in India, they have given the free cost laptop to the students. It's a very good project. They have their own lessons. Each and every lessons with the chapters have been uploaded in that laptop, so people can have their continuous examination. And so okay, so COVID is going, so people are really afraid on sending their students to the schools, because they don't know what are the basic hygiene methodologies and government hygiene, like what are the hygiene things they have been done in the schools after when they open also. So government has to ensure that these schools are secured and they can study like as before, so they can get educated. So due to this education lackage, there will be a very big change in our economical situation. So if people are going to sit 1 year in their home, and if they are not going to get educated, then it is going to be reflected in their profile for the next 1 year. So who is going to replace those positions? So that will be that is going to be a very big issue. So we need to come up with a plan to tackle this thing, that how students are going to get ready for their exams in future, because we know that without exams we can't able to find or analyze a person's educational level. So as per my country, so that is very important. So we need to come up with the next plan, and we need to ensure that when students are going to schools, they need to feel that the schools and the other things have been sanitized and properly, and if the COVID is done, they can go. They need to derive a new rule that how social distancing is going to be practiced. If COVID is not done, then how they are going to get educated, and this is going to be a very big disaster for achieving this particular education. So this is the time the educationalists and research analysts, they need to come up with their own ideas to build and sustained educational policies, so people can achieve their goals very easily. So as you guys know that even before the crisis, we have issues with gender equality everywhere in this world. So COVID is negatively impacted like many people on employment opportunities, because since before COVID, people can go to their jobs and they can do whatever they want in any time. So now many people, they are afraid on coming out of home, and they are take caring of their kids in their home. So due to these things, it will be a very big setback for the SDG 5, because women are the frontline healthcare workers, and also they are the teachers. They are the frontline people who works for their family also. So through this, gender equality have been already vanished. So we need to come up. We need to find an alternative way, that how we can enroll and how we can keep these women and girls from the society in very safe and like a very effective manner. So even like country like India, so even still we can see that women, they are not willing to work in the night shifts because of some social issues. So due to this COVID, so we don't have the proper shift, and we don't have the like numbers which we are using like in the past. So these and all things have been really reflecting on achieving SDGs 5, and even we are noticing that a lot of domestic violences are happening around the world because of this COVID, like because people they're not moving around, and they're not chatting with any friends, or they don't have a time to reflect their emotionals in any other ways. So this reflects on SDGs 5. So next, let's go for clean water and sanitation. So basically, when it comes to a clean water, now when we are in a crisis, then the primary frontline health protection is just for cleaning our hand. So as per the stats, many people, they don't have a like clean water to clean their like hands. So 500 million women and girls are adequate. They don't have a facility to maintain their menstrual hygiene because of like a less number of transports, less number of donors, less number of new waters or anything. So clean water availability is very less. So because we are using around 80% of water more than like what we used like before. So this has to be formulated in a different way. So this is what about so. So as I say that many villages in all around the world that they don't have proper electricities and all the like health facilities. So now we have been pulled to create and give the electric supplies to many hospitals because we need ventilator supports, we need proper refrigerations and proper health things to at least to preserve our blood samples and all other stuffs. So we already we just working on all the resources on the cities and all that stuff. So we are just initiated the process to give the electricity in affordable price and so using our renewable energies. So this has to be managed in very fast channel. So we need to have a global investment policy on energy. So as I said in the slide, around 3 billion people they don't have access for the clean fuels. So just for cooking. So we need to consider these things. Even these issues have been raised before the COVID, but after the COVID, the importance have been given to the priority have been given for the healthcare and healthcare workers and also for the educational entities to now people are pulled to have the, electricities. So we need to concentrate on these things. So this COVID have dramatically changed that electricity's priorities to the like hospitals and all other healthcare facilities needed. So we need to come up with different policies on these things. So as I said that people are being pulled to stay in the home because of COVID. So around 195 million people have lost their job, and it have been expected around 1 billion people is going to lose their jobs just because of COVID, and because of there is no one like vaccine for this particular virus. So companies should have an alternative plan that how they can permit all levels of workers to work in their companies. So particularly when it comes to a decent work, so people who works in a high level, they are even still they are kept in their jobs. When it comes to the lower level people, who really suffering a lot, and these people they lost their job and they have been pulled towards a poverty line. So this has to be managed, and we need to find an alternative or another solution for adopting these kind of peoples and to sustain the economic growth. As we know that people who really works in informal, so we have two sectors like formal and informal sectors. So when it comes to an informal sector, we need to understand that around 60% of our workers are working in the informal sector. So that means they don't have a job security, they don't have any kind of insurance schemes or any other things. So even these 60%, they don't live any kind of luxurious life or any other things. Just they are going for their work like a daily wages. They're earning a very little amount, and they're managing their small families. Like they need to educate their kid, and they need to just go with their food and all the other things. So government should come up with decent policies to encourage the SME, like small scale industries and other youth who really wants to start their initiatives and startups. We need to support the startups and all the stuffs, so we can sustain this SDG in 2030. So as we know that our global GDP have been gone down just because of COVID doesn't allow people to work in their industries or anything. So as I say that around 30% of global GDP is only dependent on our industries. So these industries many industries have been shut down. Many industries have been temporarily, they have removed many people uh, due to COVID, because they can't able to uh, equalize the policies and all other stuffs which have been given. The guidelines have been given by the ILO, because we need to maintain social distancing, we need to maintain supply chains in a very limited manner, because many businesses, they are interconnected with people and the supply chain. So when the supply chain have been gone, and these industries have been down. So as we all know that we believe on infrastructural development is the only solution to certify a nation whether it's an developed or underdeveloped or least developed nation. So due to this particular industry shutdown and all the stuff, the construction have been already stopped due to this COVID. So there is a very big chance that many developed nation might come to developing state, and developing state might can come to underdeveloped state in due to this COVID or any other health crisis. So we need to derive a permanent solution that how we can run the industries even through even when we are going through the global health crises. So we need to have a separate plan for that, how to make their employees to stay in their companies, how they can give the job security to people with even when there is any other health or any other natural crisis or any other crisis. So we should derive a permanent plan to achieve this goal 9 in 2030. As we all know that inequalities, as I said about when we speak about nations, so we have divisions or classification in the like many countries. As we know that income is the only thing which decides the people's status. So now, as I said, that people, they can't able to go to work, or they can't able to go to get educated. When people are getting educated, they can go for a good job, or they can have a good salary. So due to this COVID, all the things have been dramatically changed. So people had a mid-level income, they have been converted as a low-level income, because they are getting the basic salary, like which is very less amount, because they are not they're not going for any other works or as like before. So due to these things, many inequalities have been happening. So when it comes to these healthcare facilities, many countries, they don't have proper number of healthcare, as I said, when we speak about SDG number 3. So developed country has their good infrastructure. When it comes to developing region, it has very low number of infrastructure which have been developed. So we need to adapt it, and we need to find a proper menial solution for this kind of things which can sustain the equality between the each countries. So when country like India, we have very good infrastructures to handle these things. But even when we speak about very good infrastructures in India in cities, then we need to consider about the inequality which is happening in the districts which is unknown in India, like rural parts of India. They don't have a proper hospital, even they don't have the proper testing kits, but the COVID is same. So COVID is equal for everything. It doesn't see any caste, any race, any like what I can say, any locality or any kind of maps or anything. When it comes to a global, when it comes to a health crisis, it doesn't discriminate anyone in any caste. But when it comes to a facility, we have been discriminated. Many countries have been discriminated in a different phases. So as I said in the statistics, so we have a very big issues in health capacity alone. So we need to go with an equalized formula. So we need to support the people who really need it. So that's make actually sense. So we need to support these people. We need to find the solution. We need to help the people who really need. So developed nations, like well-developed nations, they can help the people like who belongs to the underdeveloped nations. So through this thing, we can achieve this SDG in future. So as we know that the COVID have been affected many people, like around what I can say, around 70% of the proportion when it compares to rural to urban, the urban area people have been affected in a very large number. Around 95% of cases have been found only in the urban areas. So we need to find a solution that okay, how these urban areas can be controlled with the overpopulated. So when you find that urban area has a very good connectivity, when they have airports, when they have port, when they have all kind of transportation, we need to have an equivalent solution to save these people. So when it comes to an public places, most of the urban places, they have park, they have like feasible places, like how people can sustain themselves in such areas, like they can go and relax and all this stuff. So when it comes to a sustainable cities, they need to have they need to ensure that these sustainable cities have been resisted, or have been built with the resistance of the thing that they are feel like safe in their places. Now you can see that many people, they have been mobilizing from one place to another place. So due to they are feeling that they are not feeling good at their own place where they are currently living, because they found that many cases which is happening only in the urban towns. So when it comes to urban town, we need to understand that these urban towns have been created by the rural peoples. So when there was a health crisis, when there was an issue with urban town, these people will take any kind of infection or any kind of things which have been given in urban towns to the rural parts very easily. So we need to understand that there is no equal equal infrastructure or equal facility which is not available when we compare with urban and the rural. Urban might have an advanced technology, when it comes to rural they might have no technology on that place. So people need to, so whenever we are designing and like cities and communities, we need to have a self realization that whether we are feeling safe on that place or not. So we need to go with the policy where these kind of things can be eradicated, and how people can feel that they are safe in their towns. So this could be affect SDG 11 on these things, because we have already closed our transportation and all the stuffs. As people who live in the cities, main cities, they are really afraid on staying there. So we need to come up with a different plan on that thing. So as we know that this COVID made us to over-consume rather than the production. So people are staying home; they are not going because they are not allowed to work because of due to this thing. Consumption is very high when it comes to protection. So even when I speak about this clean water, so our consumption have been become around 80% high before the COVID. So we need to understand that we are polluting the water very fast. So this is actually global, what I can say, global chain. So this chain actually need a particular trend to re-put all or reassign all the things. So now we don't have a particular time to we are not letting the nature to rebuild it actually. So when we are polluting last lot amount of water, we need a certain time to rebuild it. So that is a main issue when it comes to consumption and production. So as we know that all people are like most of the people, they are staying in the home, and they're consuming they are consuming the things, like they are over consuming the current, they are over consuming the food, and they are over consuming like all the things. So now this overconsumption has to be equalized before 2030, and we don't. And I believe that we don't have the certain time for that thing. So we need to spend more time on putting all the things back. So after this COVID, all the things. So people need to be very careful on consuming the things. So they need to consume only the things what they need actually. So when we are washing our hand many times, so automatically the clean water have been polluted. So we need to think about the thing how many days it will take to become a clean water, like we can use it for our future use or anything. So then when it comes to climate change, as people are speaking about that, many, like we are not using roads, and many transportation have been cancelled, and CO2 emission have been very less. So what is the problem exactly happen is, so as we all know that we are signed about this Paris Agreement for protecting our climate. So for this Paris Agreement, every government, they have a particular fund and projects. So when this COVID suddenly came, this fund and these projects have been cancelled, and these funds have been, obviously it has to be used to the global health crisis, because it's a health crisis. So even climate is also a crisis, but the thing is very like we need to save the humans first, then we can go with the nature. So that is the exact scenario. So when people speak about this climate change, I believe I'm also accepting that River Ganga have been like not much polluted, and air have been very free, and CO2 emission is very less. But the thing is, we are using more number of plastics than before. So we need to understand one thing, that we are using the plastic gloves, plastic what I can mask, or plastic anything. So when these healthcare workers and the people, they're really worried about this virus transmission, when we are using much number of plastics along with the plastic which we used before. So now we are using the plastic, and we are polluting a lot of places, and a lot of things with more consumable plastic, and these plastics are not like properly disposed, or properly what I can say, properly eliminated or anything. So due to these things, there is an abstract on this climate, achieving this goal number 13, climate action. So, and also, as I said before, that we had a sufficient specific fund and specific project for handling this kind of climate things and all other stuffs. So already when there was a slowdown in a process, they all automatically they'll be cancelling their investment. Many companies, they canceled their investment on renewable energies, because producing and renewable energy is much costlier than like producing energy from other things like natural waste or anything. So these finance have been impacting this climate action in a very bad way. So people need to concerned about using the gloves and mask. So frontline health workers, they need to use that, because they are the first line exposing elements. So people need to understand who need to use the mask, who need to use the N95 mask, who need to use the gloves, who need to use this PPT kit, and all the stuff has to be socialized. They need to be explained, because when it comes to this kind of health problem, people, they really suffered on many things, and they just rush up to the medical shops, and they have buy a lot of masks, like plastic mask and plastic face covers and plastic gloves and many things. So people need to understand that who need to use which product, so we can limitize this kind of climate. We can limitize polluting the climate through a different thing. So due to limitation of industries, many very less number of CO2 have been emitted. But the thing is, we are polluting this world to a different form. So people need to understand, and we need to go up with a different action plan. So when it come to a life below water, so we all know that there are 8,000 million. There are a lot of things living below the sea. So we need to ensure that this COVID is not affecting this particular market, because even there are very many what I can say, many illegal fishings are going on around these things, and even economically there have been a very drawback that we are not operating any kind of cargoes or anything. So these kind of economical things have been reflected on achieving this particular goal. So when it comes to life below the water, it comes to a blue economy. So blue economy is totally down because there is no water-based tourism is not done because of this COVID. International travel have been stopped, and all the things which happening in the sea have been stopped. So because fishermen are not allowed to fish like internationally, and due to these things, food security have been gone in a different level. So we need to undertake on these things, and we need to go with the things that people, whether they're using proper ships and proper things which can produce good number of a good number of fishes for food and all the stuff. So many people's livelihood have been damaged because of COVID, and this could result on the blue economy. And the blue economy is the base of this SDG goal 14. So we need to understand the economy which happening above the sea and below the sea. So we need to come up with an alternative solution for this thing. So as I said, that people really living in urban area, they wanted to migrate to their own places just because of they felt like they are overexposed. So these kind of overexposure, they wanted to travel to their own villages or anything. As I say, that without villages there is no cities. So if you come up with their family's background or agenda, they totally belongs to a village. So these things has to be follow up, and we need to create a very good sustainable land, like people where they can live very freely. So this has to be done. So this kind of migration has to be stopped, and people should learn that how they can live during this kind of health crisis in the place where they are living. Whenever the government says that they are safe
Sorry
on
to,
their place.
Dr. Murthy, sorry to interrupt you.
Yes, yes, yes.
We are almost at the end of the discussion, so
Yes,
time
just
is not
only
left.
yeah, just one slide more, and I'm just
Sure,
finishing.
sure.
Yes. So as we know that when it comes to inequality, when it comes to like discrimination, when it comes to things, automatically our peace, justice, and all other things have been eradicated, because of we can see that many inequality treatments is going between the countries, between the states, and all the stuffs. And also many our police personnels and other security personnels have been busy with handling this COVID situation. So due to this, many people, they are violating the rules and regulations in many kind of terms. So even our legal systems in many countries, they are not working in a proper term, because they can't able to travel or anything. So these are the things. So due to these things, many cases have been in pending. So many judgments have been stopped in global level. So this will be a very big setback for achieving this peace and justice for equally for all. So I'm coming to my last slide. We need to. I just have a 5 point to eradicate or as a solution for these things. So we need to understand that we need to undertake and support the most vulnerable, because everyone is not from the vulnerable group. Even every situation, even a war zone or any kind of health crisis, it will have a particular vulnerable group, and we need to take care of those groups. So if you are afraid that I'm going to affect, then I can't able to help others. So we need to understand, and we need to take the safety precaution. We need to help the vulnerable group. So that will be the best thing that we can come up with this kind of health crisis. Next, we need to protect and focus on the human rights and inclusion. So we are not supposed to discriminate anyone. We are not supposed to give anything. We are not supposed to treat anyone unequally. So we need to include each and every communities who can help in this kind of crisis. So we need to go up with this kind of policy. We need to protect these things. So when it comes to economical situation, we need to support small scale enterprises and small scale industries, new innovation, and like we need to treat the workers in a proper way, so that makes sense. Like people, they will be getting motivated and they will be working for the country. So next thing is we need to go with the education, proper education, and we need to find an alternative. We need to give an important space for education and also social measures. So the communities balance should be done. So people need to be addressed. All kind of communities, all kind of social issues has to be managed, even in this COVID time or any kind of health crisis. So if we follow these 5 basic steps, we can achieve this 2030 at least by 20, like achieve this SDGs by 2030. If not 2030, we can achieve in 1 or 2 years later. So that is all about my presentation. So I believe in this quote when it comes to COVID pandemic, no one is safe until everyone is safe in this world. So thank you. So this is all about my slide. Thank you for listening.
Wonderful. It's wonderful, wonderful presentation, I must say. Full of information, first of all, and with each and every sustainable developmental goals and their indicators have been wonderfully illustrated. Thank you so much for this wonderful session. And we have almost at the end of discussion. So we have some couple of questions from our participants. From Aishwarya, we have a question that our education system is good in teaching health and hygiene, but the problem is how to make them practice it all through the life. So that is missing point, that how to practice it.
So people might know that there was a very big movement like 2 years before. The movement was to create a Guinness World Record just for the hand wash. So through that, they just educated the people from the least developed nations how to practice the proper hand wash. So these kind of practices has to be bring up with the students. As you know that we have all the things in education. So we have all the steps in education, but when it comes to a practice, we are just relaxing ourselves because we have not affected on this much health crisis before. So now we have an example that how people should do all the things. So we need to force the people to do that. We need to ensure that whether students are washing their hand regularly when they use toilet and when they wanted to have their food or snacks or anything. So this has to be we need to input. We need to give them this task every day. So we need to have a competition, healthy hygiene competition, so students can come up with their daily ideas. So we have the basic ethics, but this basic ethics teach that we need to brush our teeth every day. We need to get calm every day. We need to have a very good hair. We need to wash ourselves every day. We need to have a cleanly food every day. We need to go up with some basic measure that what is exactly social distancing means. When a kid have a cold, we need to tell them that they need to use their handkerchief, or they need to how to use this disposable cloth or anything. So this has to be done. So when I travel to different countries, I saw many people like when they have cold, they usually wear mask, and they used to use their tissue papers for stopping their nose with the sneezing. So this has to be developed from their day-to-day action. So likewise, we need to come up with attractive attractive videos or any other things that can teach kids that what is the basic hygiene things when they have this kind of cold or fever or anything. So that has to be done.
That's right. That's wonderful. And from Jyotima Chakraborty, we have one question. While emphasizing in public health and public education should be given by the government, But in reality, we are going through different, like more the private schools in primary levels to higher secondary level, and even more private hospitals and nursing homes. Therefore, we can see government gets even more reluctant over these issues regarding health and education. Is it not contradicting with the policies of welfare state like India?
Mhm. So exactly, that is what I'm saying. So when it comes to an engineering educations, we have a lot of colleges, a lot of universities. So people born in India, they're born as an engineer, but I'm not sure about how many people they want to become a health practitioner. So when they wanted to become a health practitioner, they want to become an MBBS doctor, not with other kind of courses. Like they don't want to go as a nurse, or they don't want to go with these things. So even government of India, they have did a lot of what I can say, a lot of awareness, education, all the things have been given, but it's not sufficient. So even in India, like getting a government medical seat is a very difficult. Right. So, like vice versa, medical colleges, they can give attractive things and attractive components, and we need to tell the government that they need to adapt some good policies from the private colleges or private institutions or anything, that how these kind of health crisis can be managed, and these kinds of health things has been done. So we need people like you to give an kind of policy advice to the government. It's not only the things can't be done only through the government. Now government actually need our support, like country like India. So we are handling around 100 crore population. So when it comes to government, they can't able to give things everything in a smaller channelized way.
Of course,
So people.
privatization is very much required, but
Mm,
as such, with the understanding, private public partnerships, that is very important. So
exactly.
and that's why I think you have also done wonderful work in this private public partnerships, and how we may have another round of discussions with this, because I think that's another wonderful chapter, that how public sector is actually doing great in terms of the NGOs, and how sustainable developmental goals, as well as the self-help groups. So how self-help groups can be activated, and in this way self-help groups can be a wonderful initiative for this community developmental services. So we can have another round of discussions. Actually, we have a wonderful feedback from the participants with your particular, while having your sessions. So we have already collected the feedback forms, and wonderful feedback forms with a positive remarks with your presentation. So we are almost at the end of the discussions, and I really, really thankful Dr. Ramu for this wonderful sessions, and how we can actually motivate the youth. And from that motivations, I thought that let's have a round of series of webinars from different aspects, because in this particular pandemic or crisis, whatever is going through, is giving us the opportunity to learn from different experts like you, and other experts from maybe from academic, from community services. So that's why I thought let's have a forum like this, where we can have a series of discussions without any kind of prejudice, without any kind of comments, because people sometimes they comment so much. Whenever you are doing a good things, people will try to pull your leg and doing some negative comments, which actually demotivate you to do something, a fresh idea. So that is very important. I request personally to all of you who have presented here to connect. If you wish, you can connect with Dr. Ramu with any sort of help, any sort of collaborations, any kind of things, because he is a wonderful person in the field of community services. So I request Dr. Ramu, please share your email ID. So
Yeah.
yes, in the chat box. So people
Yes.
who have presented, most of them actually are left. So who have presented, if you are interested, please connect with him. and he is doing great work in terms of the community level services and NGO level work. So if anyone would really interested to do anything related with NGO work, you really please try to connect with him in personally. So thank you so much. We are almost at the end of the discussions. I really want to have your 1-2 lines that in future how we can work with the SDGs for the betterment of the peace all over the world. That is actually very much missing. And with this pandemic, people are very much exhausted, don't know what to do. Some kind of terrorism act can be happen in future. How we can deal with them?
So, in 2 lines, right? So, we need to work for others. So that is the only suggestion and only ideologies that what we have. So when we think about like people who below, like who living below us, so when you want to take them with you, when you wanted to empower them like equally, then all the sustainable development goals will be achieved very easily. So we can counter anything, because when like people when I was kid, I can see like a lot of people uh, they won't go to hospital because they might not have much money, but now they have sufficient money, but they don't know how to use it actually. So people like people who earn a lot, they're spending a lot on their personal things. I'm not saying that they can't able to, they're not supposed to do that, but the thing is, so there was one small incident which happened. So one day, one of my friend, he gave me a party for the bill amount of 35,000. So it was around a small party with 20 people, right? So next day, one guy who came to us, and he was saying that his mother was supposed to do an operation, and that cost around 13,000, like 13,000. Then I found very very guilty on that aspect, that particular term. See, for an enjoyment, we have spent around like 35,000. When it comes to a very serious issue, these people, they don't have much money. Like 13,000, when it compares to 30,000 is not a big deal for us, right? So that is what that really hurts me even now when I think about that particular thing. So from or on that day, I'm not spending much money on any parties. I never give parties, because I know that when we have money, we can enjoy, but it should not be in a bigger amount. So people even now, they are suffering for this kind of medical things without rupees 100. So rupees 100, we are just recharging our mobile, we are using for anything. But even people are living in this world without 100 rupees for spending their basic needs for their health purpose, like health purpose or perspective. So just think only one thing. So whatever money you have as an extra, just spend for others. So just empower them, just enrich them, that's it. So we can achieve all the things. So just show your love for everyone. So that is only my thing.
Wonderful. That's wonderful. I think with this positivity, and that's the positivity we actually need for the motivation of the youth, because youth, they really need to have appropriate guidance that how they will move on with their career, maybe with their they have some amount of money, but they don't know how to utilize, how to use that one.
Even
So I
knowledge
think with this,
also.
yes, knowledge is also same, because we are somehow not enough mature to share our knowledge,
Exactly.
and we somehow thought that, okay, keep it within ourselves, don't spread with others.
Even
it
they don't
it
even
it
they don't know to teach that they know well known, and they are practicing it
exactly.
every day.
Exactly. Thank you so much. And we may have a round of discussions in our upcoming months with you, and with some other topic, or maybe with a similar topic, but with a very specific SDGs and their goals. So
Exactly.
we can divert the goals, and we can discuss a particular things. So thank you so much, Dr. Ramu, for this wonderful sessions.
Thank you,
And
Swati, and
namaste.
namaste. So thank you for everyone for listening very patiently.
And be safe, all of you. Please stay at home and be safe.
Okay, bye bye. Thank you. I'm just signing.